गड्डी लेके ओ हो हो ओ हो हो आ हा 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 मैं निकला ओ गड्डी लेके ओ रस्ते पर ओ सड़क में एक मोड़ आया मैं उठ दिल छोड़ आया एक
And welcome, ladies and gentlemen, to this very, very special segment where we bring to you IMA Qld, presented by the Indian Medical Association of Queensland, and a very wonderful program today. So welcome, sit back, relax, and as we present to you this very special program brought to you by the courtesy of Indian Medical Association and Queensland brand, and a very special thanks for everyone behind the scenes for making this happen and making this possible.
Hello everyone. The Indian Medical Association of Queensland has been running a public health lecture series since March 2020. Our members, who are doctors of Indian origin, practice in this wonderful sunshine state of Queensland. They volunteer their valuable time and expertise in this endeavour. The advice given by any doctor is of a general nature and meant for information and education only. Please note, this is no substitute for your own health care professional, and everyone is advised to consult with their own treating physician for ongoing health issues. I will now ask the Secretary General of the Indian Medical Association of Queensland, Dr. Cyril Fernandez, to introduce you to our guest speaker of the month.
Listeners, today we have the pleasure of talking to and listening to Dr. Rajiv Gandhi, a senior general practitioner, fellow of the Royal Australian College of General Practitioners with wide experience of practicing as a general practitioner in Queensland. Dr. Gandhi is a fellow of the Royal Australian College of General Practitioners, and on today's Indian Medical Association of Queensland IMA Shehath program, meaning your health, Dr. Gandhi will highlight a few messages of information on health matters to you viewers. Liz has already briefed about this public health message to you. So Dr. Gandhi, let me first start with my first question to you for the viewing and listening pleasure of our viewers. Please tell us about your background, educational, professional, your achievements so far as a general practitioner in Australia. Please, thank you.
Thank you for having me in here. So my name is Dr. Rajiv Gandhi. I have been born, brought up in India, and had all my primary schooling from St. John's in India, and then I did all my medical schooling in India. After that, I've had the pleasure of working with few places, and I've had working in the major hospitals of Delhi, and had done general practice while there in Delhi itself, which is the capital of India. I've had the experience of working as a personal physician to the Deputy Prime Minister of India, and had vast experience of traveling with him all over the country. I've had the experience and to establish about 32 clinics all over India, which included primary health, physiotherapy, and natural medicines, and general public health. So apart from that, I was the medical superintendent of a 1,000-bedded hospital in New Delhi, and I was the medical in charge there. As life would have it, I tried to get out of the country, and I was there as a senior medical officer in Mauritius, a beautiful country in the Indian Ocean, and I was there for 4 years. Then I came back to Australia in 2007. Since we've been in a lot of big cities and metropolitans, we wanted to try something different, and it was a difficult thing, but I joined as a senior medical officer with right to private practice in a very remote town of Queensland, which is about 1,000 kilometers away from Brisbane, and we were only 2 GPs there with a 24/7 coverage of the GP clinic and the hospital.
Which place?
This was in Blackall, a small lovely town in Queensland. It's a small town, but very friendly people, very difficult responsibilities because you are 24/7 on call, 365 days a week. You have to do the whole of the general practice and the hospital call, and you're the only doctor in town at times, which I've had for 10 to 14 days. I've been the only doctor 24/7. It was a difficult, but the community was lovely, and it was a very vast experience there. So, and the closest place where I could shift a patient from there was 700 kilometers was Rockhampton, and then 1,000 kilometers was Brisbane, of course. So that was a very good, vast experience there, but I was there for full 6 years and really enjoyed it, and my children and my wife also all were there, and they enjoyed the whole atmosphere. It's difficult but very good as such. So got very good fond memories of that. Then I've been in Brisbane since 2013 after completing all my fellowship and all that. So I'm working there. I'm working here as a GP in one of the in South Brisbane, in Daisy Hill practice, and in Beenleigh. So I've also had I've also been passed the DAME exam, which is I'm the independent medical examiner for civil aviation medical examinations, and also the fellowship to complete all that. So this is my.
Oh, it's good to know of your vast experiences both in India and Australia. And when you were mentioning about Delhi and the Prime Minister, incidentally, you have the name of one of our famous Prime Ministers of India, Rajiv Gandhi.
Yeah, that's a coincidence.
So it's good to listen to what you had to tell us viewers. Now look, Dr. Gandhi, GPs are the gatekeepers of primary care and play a big role in preventive medicine and health. And we know GPs deal from hair to toe, nail medicine, But some GPs tend to have a special interest in areas like mental health, men's health, women's health, osteoporosis, chronic diseases, diabetes, heart conditions, anemia, and so on. So, Dr. Gandhi, can you please highlight on some of your special areas of interest in general practice?
As you've rightly pointed out, general practice is an absolute complex situation, and it's everything of everything, you could say that. So obviously I've really enjoyed doing general practice, and it's a real passion, but my few of the areas of special interest are women's health, and also diabetes and chronic disease management. So we have been doing the women's health, which includes antenatal checkups. I try to do comprehensive antenatal checkups right from the stage of pre-pregnancy counseling these days, when the people want to really plan it, that they're going to have a child, that's 6 months or 1 year before that, and what are the things which we really need to help them and tell them to have before they're all planned for that, in the medical perspective and the mental perspective. And so that's one, and then follow the whole of the pregnancy and the childbirth, and that's a lovely feeling, and after that immunizations and so on and so forth. So that's one aspect. Number 2 aspects of women health include a lot of things with chronic disease management and anemias. Anemia is also one of the prevalent, which I've been doing here as part of it. And then the another aspect is diabetes is one of my passions also, and I do a lot of diabetes and chronic disease management.
Yeah, that's a good area of coverage. Can you please highlight a bit more on anemia for the listening pleasure and information of our viewers, please, Dr. Gandhi?
Thank you. So anemia, as you say, it's basically a lack of hemoglobin. Is a lack of hemoglobin in the blood. Basically, the blood has got three types of blood cells. One is red blood cells, one is the white blood cells. The white blood cells are there to combat infection. The platelets in them are there to help the blood clot, and the red blood cells are there to deliver oxygen to the whole of the body. So the red blood cells have got a constituent called hemoglobin, which carries oxygen to the whole of the blood. To carry this oxygen and to maintain the healthy life, they need few ingredients like iron, which is most important, other essential nutrients like B12, folate, vitamin C, and other nutrients to maintain this healthy life. So it's an absolute wonderful mechanism in which all the blood is supplied with oxygen and the nutrients are needed for that. So anemia, as we call as lack of hemoglobin or the color of the blood, is of different types, but the most common anemia all over the world, more so exceptionally in the developing countries or the underdeveloped countries, is iron deficiency anemia, which is prevalent in Australia also. Now, iron deficiency anemia, as the word goes, is basically either there is deficiency of the oral intake of iron, that's one, or there's an excessive loss of iron in different things. So one is the deficiency of iron when you're not eating enough, number one. It could be seen in young girls and women who have heavy periods and menstrual loss. It could be seen in chronic diseases like autoimmune diseases, chronic disease like Crohn's disease, intestinal inflammations, or celiac diseases. It could be seen in people with other chronic diseases like HIV or chronic type of things, which get deficient as and when the years go by. So
any symptom, like how do they present?
So the way they present is it's got a multifaceted presentation. They could present from simple things, from weakness, fatigue, pale skin, irregular heartbeat, fast heartbeat, feeling very tired, not having even the pleasure at times, and they could feel confused, they could feel dizzy, and they feel the loss of interest, are not able to wake up properly, and these are the common symptoms.
Any tests we can do?
So what we do is, we as a routine, we do general blood tests. We do a simple blood test like a routine full blood count, which will also show us the iron studies. So we will do the full blood count, this is called a complete hematology test, along with iron studies. So this will really tell us how much the patient is deficient in iron. We do B12, we do folate, and do iron studies and the full blood count, along with the routine kidney liver function tests as part of the completion. So once we find that this iron is deficient there and all that, then there are different things which we need to make sure that what's the cause, whether the patient is eating well or not, whether they're in some people who are vegetarians may lack iron, that's one thing. People who are having too much of bleeding, heavy menstrual bleeding, can have loss of iron. People I've seen with chronic bleeding or acute bleeding, I've seen people who got migraines early morning, 3 o'clock, wake up, 2 neurophins, and they can get bleeding from here. That could be not even noticed there, and they could have black stools there. So anything which is there, it needs to be brought to the respective GPs, who will do a comprehensive test, and he or she will explain the test, that what is the cause, whether it is lack of vitamin B12, and which is mostly seen in people who are vegetarians or who've had a surgery for the gut, where the B12 is not being very well synthesized or absorbed well. So these are the main things.
How do you treat these patients? You know,
See,
maybe because based on the cause, can you please highlight
yes,
on
so the
therapy?
basic treatment of causes are all from, first of all, we need to get the oral supplements, right? We don't want to only rely on medicines. So the most important things, you know, as iron-rich foods, like we start from 1, 2, 3, 4 is meat. Beef is a very good source. Meat is a good source. Chicken is also a reasonable source, but liver, meats are one of the best sources. Number 2 comes to the green vegetables, dark leafy vegetables, which include spinach, kale, broccoli, green vegetables, and that is one thing which is the most important part. Then we come mostly to all the vegetables with broccoli and all that are very good sources. Then we go to the very good sources for beans, which includes kidney beans, soya beans, chickpeas, simple peas, and also the pinto beans. They are very good sources of that. Lentils are a very good source, like very famous people like in the kidney beans are very good. And then we come over to fish. Most of the fish is a very good source of iron, but canned and fresh tuna, sardines are quite good sources. Then if you go from the fortified juices and cereals, oats and all that, they're good sources there.
Medication wise?
Medication wise, we go start from simple medicines like iron. Fortified bread is a good source, but medicines will go for iron supplements. Iron supplements are good source, but we have to explain the side effects of that. Some people may get constipated, some people may have discoloration of the mouth and all that. Even in children we're seeing a lot of these things there. So iron supplements are a good source, but we have to make sure whether it is purely because of iron or B12. If B12 is lacking, we may need to give B12 supplements in the form of injections, which improves really very good. And folic acid is also a very common deficiency things, in which is found in all those green leafy vegetables, fortified cereals and breads and all that. So and lot of nuts, cashew nuts, and also the pistachios can have these ones.
Do you give the iron as an injection form?
See, initially, a lot of time from ages onwards, people have been on iron, but it takes a lot of time for oral iron to there. And I've seen people, even after a few months, they may feel, oh, it's still not getting up, you know, I'm feeling tired. Way back, people used to give, and still might be giving, some injections of iron in the buttocks, which was a very painful, number one, and it requires a very important technique to give that iron, because a lot of time people used to get massive bruising in the buttock due to that iron, and very painful. So there is a special technique in our language which we called as a Z technique, which the nurses used to follow to give a proper iron in the buttock, but that's very painful. Now the latest things which we do and which have been really proved very beneficial are iron infusions. This is like a new injection which we give. It's not new, but it's been given from a lot of time, is called as Ferinject. Ferinject is a very nice, and we've had few meetings with a multitude of cardiologists, gynecologists, hematologists and all that, and they do recommend, even in few of the even elderly patients, you can give iron transfusion. See, every infusion will have its side effects, but it's very, very, very safe. And it really gives you quite a bit of benefit from that. Initially, we used to be sending it to the hospital or specialized centers there, but nowadays we do a good practice and all that, and do iron infusions in proper equipped clinics. As such, it's a 20 to 25 minutes procedure, but we try to keep the patient for an hour, get him to get the Ferinject injections, put it in 250 mils of saline, and it is given intravenously, and it is being properly monitored with a dedicated nurse in all the centers who give it, who manages the blood pressure, pulse and all these things, and gets temperatures and everything monitored before, during and after that, and the patient is kept about 25 to 30 minutes after the infusion, and it's given us very good results. So it is a real good thing to do that, and it improves it quickly. Of course, we need to maintain it by telling them to continue with the good foods and the best of the foods which can be giving them the right proportion and they feel healthy. Of course, we do the test for seeing how the iron transfusion in 2 weeks or then in 6 weeks that it's maintained well.
That's very nice of you, Dr. Gandhi. You have highlighted as a senior general practitioner with a lot of wide experience, different aspects of general practice, especially on anemia, which I suppose, I'm sure will be of high value to our listening viewers. Now, Liz may have asked you something based on for our listeners' information. Please, Liz.
Dr. Gandhi, what are your hobbies and other interests outside of being a GP?
Oh, that's a nice question. So it's, I mean, of course, music is one of my greatest hobbies. I mean, I'm a very ardent fan of Bollywood old music, but a lot of other music also, but mainly, and now sports is one. And not getting much time, but I love to play cricket. So whenever we can steal time, we can try to do that. And then these are the two main ones. But I definitely enjoy reading old novels and old books, but all classics there.
Sounds lovely.
Right.
And finally, Dr. Gandhi, can you please tell our listeners what is your message to maintaining a healthy lifestyle?
All right. A very wide thing. This is, see, the only thing with the healthy lifestyle is, first of all, I mean, we don't want to make people as patients. We want to enjoy life also. But I would advise them to be sure that they maintain a proper healthy eating habits. First of all, eating regularly, not having too much of gaps, small amounts of fluids and food frequently, maintaining a choice of foods, not over or binge eating at times, and healthy food in a perspective like green leafy vegetables to supplement with the meat, right? And have fruits and vegetables and all the healthy things in a good proportion, and not taking ample amount of fluids. I would advise not to take any medications empty stomach unless specified by a doctor, and make sure that a full nice calorie food is maintained, and heavy good amount of fluids and food in an appropriate proportion. If not clear, we are always available to tell them, the dietitians and online things and all that. And sometimes I would advise not to over believe on the internet. Sometimes people come to us and said, I went to the internet and headache, I think I've got a tumor. So that type of things not to be carried on with that. That will be my advice, to eat very healthy, do a simple 30 minutes walk for 5 days a week is a hallmark to keep what you're eating assimilating well and giving you the good effects.
That's great advice. Thank you, Dr. Gandhi. On behalf of the Indian Medical Association of Queensland, I would like to thank you for this wonderful presentation and your time today.
Thank you very much.
Thank you.
Much obliged.
And ladies and gentlemen, thank you very much for joining into that very informative session today. I thought, especially for me, that was very, very beneficial. A lot of the things that we do, especially being, with that iron deficiency and all the techniques that the doctor has mentioned. And of course, not being too reliant on Google, or meaning the internet. Our GPs are there for a reason. Well, ladies and gentlemen, this has been an Australian Indian Radio presentation and an Indian Medical Association of Queensland's production. And thanks very much to the team, Liz, Cheryl, and of course Dr. Rajiv today for that very informative session. Now, if you have, this segment will be repeated on the radio with an audio version only tomorrow. at 10 a.m. once again. So Sunday on Australian Indian Radio. Now to listen to Australian Indian Radio, there are so many different platforms. You can go to the platform of your choice. All you need to do is type in Australian Indian Radio Listen Live, and you'll get a list of platforms to listen via, like TuneIn, Streamer, radio.oq, radio online. So there's many of them, or you could just go directly to our website as well, and you can listen via there as well. So each and every segment will also be posted on our SoundCloud for someone who is missed and someone who would like to go back and look at the episodes. And of course, all the episodes are available on the YouTube channel of Australian Indian Radio. So each and every episode will be on our YouTube channel as well, and you can watch via our YouTube channel as well. So there's so many different ways, but once again, it takes time and effort to produce a show like this. So it's very special thanks to the team, and especially a great thanks to the Indian Medical Association of Queensland and for putting this together on a monthly basis for our viewers and listeners. And it is just wonderful to see that kind of community careness and community connect. Until the next show, it's goodbye from us.